$12 million. Now, that is how much taxpayers are spending on medical services for dead people, and that's just one state. The Illinois Medicaid program paying out $12 million to dead people. Representative Peter Roskam joins us from Chicago. Good evening, sir.
Greta, how you doing?
Good. Well, the good news is they collected about $7 million back on the $12 million of the dead people. How does this happen?
Well, this happens because these systems are so big and so inefficient that they're not talking with one another. So right now, you've got Medicaid, which is literally paying out benefits to people who have passed away, which is an outrageous scandal. And here in Illinois, the reason that happened was there was a private contractor that had this largely under control. The contract was dismissed under public union pressure, so Governor Quinn brought it in, and now the public unions haven't been able to keep up with the work. That's how that happens. But it raises a larger problem, and that is you've got states that are finding out information about people that shouldn't get benefits, and they're not communicating that in any substantive way to these federal programs like Medicare. So you can have a state that discerns somebody shouldn't be able to get a particular benefit, but that information, by and large, isn't being shared back with the federal government.
All right, just to give a shout out to the AP, they're the ones who did the FOIA request and took the names against a database, and they're the ones who discovered this. It wasn't like Illinois volunteered it, that they were squandering this taxpayer money. All right, now Senator Coburn introduced a bill, in the Senate, to try to handle this issue, avoid it. Is that right?
Yeah, so what we're trying to do, and it's parallel to legislation that I've introduced in the House, and it's trying to do a couple things. Number one, anticipate by using predictive modeling who it is that should be getting a particular benefit. So use the type of credit card technology that financial services companies use, predicting who it is that should be getting something done. But the other thing is, it requires the Department of Health and Human Services to say, look, you've got to do this better. You've got to get it so that the federal government and the state government are talking to one another. Right now, only 10 states who find out they've got fraudsters in their system report that information back to the federal government. And this is a massive problem, and it's been understated. 10% of Medicare, or about $50+ billion a year, is either paid out in false claims, fraudulent claims, or duplicative claims. But however you characterize it, it is a complete waste of money, and we've got the technology to deal with it right now.
All right. Now, the reason why it hasn't come up for a vote in the U.S. Senate, I know that you're a Republican in the House, you can get up for a vote. Why hasn't it come up for a vote in the U.S. Senate?
Look, there's part of a larger, in the House at least, it's part of a larger discussion trying to move forward and move these massive systems. So if you listen to the federal agencies, they'll wring their hands and they'll say, hey, we're doing our best and we're doing everything we can. But the bottom line is they're not. These systems are in place. They're very, very old models. They're literally wasting billions of dollars. And in a nutshell, we can do better, and we've got to do better.
Representative, thank you, sir.
Thanks, Greta.